We must not allow this situation to happen. I'm therefore appealing again to all Kenyans that in order to try to manage these numbers, to keep down these numbers as we move along, as far as possible, flattening the curve and pushing it to the right as far as possible, allows us to be able to deal with those cases that come up that need clinical management, given our capacities of our health systems. We need to manage that, and the way to manage that is through the containment measures that have been put in place. I appeal to my fellow Kenyans that we must more than ever now strictly adhere to the containment measures that have been put in place. That is the strict observance of hand washing and hygiene, social and physical distancing, wearing masks, avoiding gatherings. All of these measures will be able to allow us to push this curve so that we can be able to deal with those that turn out positive and those that need clinical management. The positive cases now push our cumulative numbers to 4,044 out of a total of 124,474 samples that have been tested in the country so far. In terms of gender, 129 of the cases today are males, while 55 are females. And all of them except one are Kenyans. The 184 positive cases are distributed in counties as follows. Nairobi has 111 cases, Mombasa 19, Kajiado 14, Meru 13, Kiambu 9, Busia 6, Nakuru 4, Machakos 3, Kwale, Kisumu, Garissa, Taita Taveta, and Vihiga counties, 1 case each. The last county, Vihiga, now becomes the latest county to record a COVID-19 case, bringing the total number of counties so far affected to 40. By sub-counties, the cases are distributed as follows. In Nairobi, there were 33 cases in Westland, 19 in Kibra, 18 in Langata, 15 in Embakasi East, 12 in Dagoretti North, 4 in Kamkunji, 2 in Makadara, 2 in Starehe, 2 in Embakasi Central, Roysambu, Embakasi West, Kasarani, and Embakasi South had 1 case each. In Mombasa, the cases are from Mvita, 9, Changamwe 4, Likoni 2, Nyali 2, Jomvu and Kisauni, 1 case each. In Kajiado, we have 12 cases from Kajiado Central, Kajiado East and Kajiado North, 1 case each. In Meru, the 13 cases are all from Imenti North. And in Kiambu, the 9 cases are from Lari 3, Juja 2, Kabete, Kikuyu, Kiambu Town, and Limuru, 1 each. In Busia, all 6 cases are of truck drivers in Malaba and Matayos. 5 in Malaba and 1 in Matayos. In Nakuru, the 4 cases are from Naivasha, 3, Nakuru East, 1. In Machakos, all 3 cases are from Athi River, while in Kwale, the 1 case is from Lunga Lunga. In Kisumu, the 1 case is from Kisumu Central. In Garissa, the 1 case is from Garissa Township. And in Taita Taveta, 1 case is of a truck driver. In Vihiga, the case is from Vihiga town. On a positive note, we are glad to report that today we have discharged 27 patients from our various facilities, bringing the total tally of recoveries to 1,353. Sadly true, we have lost 2 more patients to the disease. The total number of fatalities now stands at 107. And again, we express our deepest and heartfelt condolences to the families and friends of the bereaved during this trying moment. Fellow Kenyans, as we have observed, our numbers of positive cases are steadily rising, and it is a matter that we all need to be concerned about. This further confirms that community transmission is now quite well established within the country.